Something that I think would be very helpful for pastors would be if the two of you could speak to us as pastors and to those who are watching about some of the pastoral care issues related to end-of-life care. I know, for example, one of the questions I'm asked on a regular basis when I visit families in the hospital with a loved one who's clearly suffering, they will ask, can we remove the respirator? What can we do to make him comfortable? And are there moral implications to that? Is removal of care a form of assisted suicide? Help us understand what we can and maybe should be careful about saying to families that are going through that process.
Mm-hmm. Very good question. Removal of care, such as a respirator, would not constitute euthanasia or assistance in dying as it's been defined. Whereas pushing medications to prematurely hasten that person's death would be. Something that we're removing is allowing the body to die through its own natural process.
Right. And what are the implications with morphine? Because sometimes when a person is suffering, you can give a dose of morphine that effectively hastens departure. Are there any guidelines that a pastor should be aware of in that situation?
I think the really important thing is that you are giving the medications to ease suffering and not to hasten death. Morphine can stop respirations, so it could hasten death. There are some people who believe that by easing the suffering with morphine, you are actually not hastening the death. So there are the two views to look at it.
Right.
And I think it's all about the intent. What is your intent in doing this?
Now, I'm sure you see a lot, this is sort of an off the charts question, but I'm sure you see a lot of pastors coming into the hospital to provide end-of-life pastoral care. I have never had the opportunity to ask this question, so I'm going to now. What could we do better?
Very good question. If there is a question from the member that you're attending to about removal of a respirator or removal of various implements keeping that patient alive, it would be probably prudent to involve one of us in a discussion. If we're around at that particular time, that would be a discussion that I would be happy to participate in. And happy to care for the particular individual.
Now, are other doctors likely to be as open to having conversations with a member of the clergy? I mean, obviously you do. You attend our church, right? So you and I having this conversation with a family is not going to be a problem. Are other physicians likely to be as open to that?
Hard to say.
Hard to say, so that'll differ. But at least make the attempt. Anything, Diane, that you would say to us? What could we do better?
I think you do it really well already, and it's Pastor Bill that I've seen in the emergency room.
Well, don't judge me by Pastor Bill. I couldn't
so
carry his shoes, so
yeah,
he's fantastic.
And he just sits with people, and really that's all we need to do is just sit beside them
and
hold
sings
their
with
hand.
them. Did you ever hear Pastor Bill sing? Yes. So, Josh, do you have any songs? Good. Just basically being there with people, praying with people, and engaging the physician as part of the care process. Is that?
If required, if deemed necessary at that particular junction. Sometimes it's not necessary, but if you feel or anybody else feels that it would be of an aid, then yeah.
Great.